Hi, my name is Akiko Suzuki. I choose the Lab 5 from Week 5 Skeleton System for the video assignment. The reason I choose this topic is because I did not really like learning the parts of skeleton when I was a nursing school student long time ago. It is hard to remember the names of all parts of bone. I have not had to use bone terminology in my unit, which is the Neonatal Intensive Care Unit, NICU, and I haven't had any opportunities to use it in the United States either. It is refreshing to relearn all parts of the skeleton and its functions. Also, I would like to know all the correct pronunciation since English is my second language. I would like to overcome my weaknesses through this video. So let's start it. For week 5, we had to learn the location of bones. I will focus on the skull part to explain the structure, and also I will explain the location with the skeleton model and feel like palpate each area on my head and face as well. So here's my partner for this video, the skeleton model. The human body consists of axial skeleton and appendicular skeleton. The skull is a part of axial skeleton. The skull is formed by cranium with 8 bones and facial bones with 14 bones, so 22 in all. The cranium encloses and protects the fragile brain. The facial bones are the framework for the face, secure the teeth, contain cavities for the special sense organ of sight, taste, and smell, provide openings for air and food passage, and secure the facial muscles of expression. I will follow the order from the lab manual procedure on page 134. Okay. The first one is the temporomandibular joint, TMJ, or we can call it jaw joint. It is located just anterior to the ear. Here. I can place my finger just anterior to my ear canal, and I can feel it by opening and closing my mouth. Here. This part is the most easily dislocated joint in the body. When dislocation occurs, the mouth remains wide open. At least 5% of Americans experience this painful temporomandibular disorder. The next is the mastoid process, which is part of the temporal bone, and it acts as an anchoring site for some neck muscles. It is hard to show it with this skeleton model, but it is easy to palpate it yourself. Place your finger just posterior to your earlobe and apply pressure so you are able to feel a bump. The mastoid process is full of air cavities called mastoid air cells, which puts them at risk of infection themselves, such as mastoiditis or mastoid sinus infection. The next one is the zygomatic bone and arch. The zygomatic bones are often called cheekbone. It articulates with the zygomatic process, which is here. Here is the zygomatic arch. To feel the zygomatic bone and arch, place a finger on your cheek, just inferior to the eye, and follow it laterally around the temporal bone. The next is the greater wing of the sphenoid bone. The sphenoid bone is bat-shaped and spans the width of the middle cranial fossa. Here it is. Place your fingers in the notch posterior to the eye orbit and superior to the zygomatic arch. So this part. The next one is the infraorbital foramen, which is placed at the maxillary bone. It is just below the eye socket on each side. Here. It allows to infraorbital nerve and artery to reach the face. Place the finger on the cheekbone inferior to the eye orbit and slide the finger medially under the eye and apply pressure. The next is the mandibular angle. Here is the mandible bone, such as the lower jaw. The mandibular angle is located at the posterior border at the junction of the lower border of the ramus of the mandible. To palpate it, move your finger posteriorly along the mandible until the bend at the back of the jaw is felt. This is mandibular angle. And related to the mandible, here is the mandibular symphysis, which is the middle of the mandibular bone, and it is a slight ridge. You just need to place your finger on the middle of your chin. So this one. The last ones are the nasal bone. They are fused medially and form the bridge of the nose. Here. It is easy to palpate it. You just need to place the finger and thumb along opposite sides of the bridges of your nose. There are all the procedures from page 134. Once you palpate your bones and practice doing it, you become familiar with the bones, and it helps to remember the names of the bones as well. Thank you for watching.